We are going to discuss our critical literature topic of enhancing occupational engagement through the use of digital technology within the older adult population, which was designed by Dr. Alicia Jones. I'm Hannah Carney.
I'm Alexis Allen.
And I'm Shelby Peterson.
We'll begin with discussing our guiding clinical question and rationale. Our guiding clinical question is, how does the use of digital technology enhance occupational engagement in daily activities within the older adult population? Our clinical question helped with defining the purpose of our critical literature review, which is to enhance the understanding of the older adult's perspective of digital technology to decrease barriers and enhance occupational engagement. So we wanted to gain a better understanding of the older adult population's perceptions and experiences of using digital technology. In doing so, this information gives insight into how to create occupational therapy interventions to best enhance digital technology use in older adults. Now we'll look at the background information of our review. The adult population was defined as adults 65 years and older that wanted to learn to use technology. And as we know, technology has altered how occupations are carried out, and there is very little information about how this has impacted the daily lives of older adults. New technologies are likely to change the dynamics of occupations, and studying this among older adults is especially important due to the risk of their occupational engagement and performance. Technology is beginning to be recognized as an issue within the older adult population because they do not have as much knowledge on the use of technology. The methods used to generate the results throughout this poster includes databases search such as PubMed, Journal of Gerontology, British Journal of Occupational Therapy, Sage Journals, and Cyber Psychology. Search terms utilized include technology, technology use, digital technology, older adults, geriatrics, aging in place, occupations, and activities of daily living. The inclusion criteria was studies published within the last 10 years, written in the English language, peer-reviewed, and older adult population, and studies related to technology use and occupational engagement. The exclusion criteria was studies that did not have a focus on the older adults, digital technology, and occupational engagement.
We found three key themes through the review of the article's results, which include occupational engagement, social participation, and identified barriers. The first theme was that through digital technology used in older adults, occupational engagement was improved. Financial management, emergency maintenance, joining the library, scheduling doctor's appointments, shopping, and various leisure activities were identified as increasing participation due to digital technology used in older adults. As for the second theme, social participation, it was seen that interventions that focused on enhancing older adults' skills and knowledge of digital technology promoted social participation and increased feelings of social connectedness in older adults. The third theme was the discussion of barriers that older adults experience due to digital technology. And this information is important as it gives practitioners understanding of where they may need to intervene to support engagement in digital technology and promote occupational engagement. Some barriers older adults identified includes fear of judgment when learning to use digital technology, the lack of age-inclusive training, personality, and cognitive traits, financial costs to afford digital technology, the amount of time it takes to learn how to use technology, how complicated it can be to learn, and the lack of control when using technology. In summary, the results showed that occupational engagement in older adults has improved as a result of the use of digital technology. Social participation was enhanced through the use of everyday digital technology from increased feelings of social connectedness. The barriers that are experienced by the older adult population due to digital technology were defined.
Some of the limitations of the included studies were due to the fairly small sample sizes, which made it more difficult to transfer the information gathered to the population of older adults as a whole. In addition, the recruitment methods of the sample population and the various sites were not consistent throughout the studies, which also decreased the transferability of the information. As for limitations of the literature, there has been little research conducted on the impact technology has on the everyday lives of older adults. With implications for practice, occupational therapists can intervene at the individual and societal levels to facilitate occupational engagement and performance for those that are experiencing challenges with technology use. Occupational therapists can also intervene by addressing older adults' feelings towards safety and control in regard to technology use, and utilize technology that allows for the transfer of important meanings into altered occupations. which means older adults are doing the same occupation but in a different way through the use of technology. For future research, it is suggested to increase generalizability of the results by testing the sample in various contexts, increase sample sizes in the studies to increase transferability of the results, and explore the efficacy of various intervention techniques with older adults and technology training in the field of OT. Here is our QR code that can be scanned to view our abstract and references, and that concludes our critical literature review poster. Thank you for listening.